Now joining us is Claudia Chender, the leader of the NDP. Claudia Chender, thanks for joining us. We appreciate it.
My pleasure, Todd. Good morning.
Good morning. So we often throw the word crisis around. That is used quite often, and in many cases it's not appropriate. But when it comes to healthcare, I think everybody would agree that this is a serious crisis right now, particularly with emergency rooms. What are your thoughts?
Absolutely. And, we have been sounding that alarm for quite some time and I think it's emergency rooms, but emergency rooms are sort of the canary in the coal mine. And so as we hear more and more from families and physicians and nurses on the front lines, we know that this is also because of a staffing crisis we have in our hospitals and a lack of long-term care and not enough paramedics and difficulty accessing that service. So the system is under enormous strain. And, unfortunately, we're now hearing the stories of the people who are suffering and dying because of it. And so I think we can't talk about this without, first acknowledging the pain that families are feeling, particularly the two families who have come forward in Cumberland County and in Cape Breton. But we know that there are lots of other families who, have experienced the same questions and the same sorrow. So my heart really goes out to them and to people across this province. And I think, as you say, I think we all agree now that we're in a crisis. And so the question is, how are we going to fix it and what's actually happening? And that's why we are calling for an inquiry into this because, we've known for a really, really long time that this is a problem. We know from the numbers that more people are dying in the emergency room each year. And what we don't understand is what's being done to fix it or why it's not getting better. And I think Nova Scotians deserve answers to those questions.
All right, so when you talk about what's going on here, the head of emergency medicine for Halifax and the surrounding area says ERs are under the most extreme pressure that he's seen in his 23-year career. Taking a toll, says ER staff are extremely worried they're going to be put in a position where they're not able to manage the expectations or even the needs of the patients and their families. When it comes to meaningful change, says the province must address a number of different problems, including increasing access to primary and walk-in care, adding more hospital beds, hiring more nurses and physicians, and increasing the availability of community health and home care resources. So this, according to him, is it's the solution is not easy, but he's saying this is the solution. Basically, he's laying it out right there, is he not?
Absolutely. And I think you and I have talked about most of the items on that list in the last 6 or 9 months. We know that we need increased access to primary care. The latest numbers are 130,000 people without primary care, but that list is at least probably the real numbers are double that. If people don't have primary care, they have no choice but to go to a hospital. If people don't have long-term care, they have no choice but to stay in a hospital. And so I think that list in the article published this morning, there are, lists from the Nova Scotia, the NSGEU that represents nurses with some really practical advice on staffing and how to alleviate some of the pressures. Elizabeth Smith-McCrossan, the MLA in Cumberland, she provided a list from her community. And so our question is, it seems like there's actually quite broad consensus on the work that needs to be done, and yet things are getting worse. And so the question is, why is that? We have a government, as everyone has repeated a lot, especially lately, that was elected to fix healthcare, and everything is getting worse. And so it may be that they are trying, but whatever they're doing, it isn't working. And so we need it to work. We need people to be able to rely on their emergency medical system, to call 911 and get a hospital. And we need, all of the seniors and families that we hear from every day to know that they can rely on our medical system. And so we want some answers about how that's going to happen and how it's going to happen quickly. There's lots of good suggestions of how to do it. Why aren't we acting on them?
Okay, well, it seems to me like as I'm reading this laundry list of what the doctor is saying is needed here, these are things that are not going to happen in a hurry. They're just not. So might we potentially have to look at something that I don't know, some outside the box paradigm shift, something like that when it comes to dealing with healthcare over the next year or so to help us deal with the resources that we do have that can somehow improve things within the envelope that we do have? Because it's, kind of navel gazing, looking out, saying, well, someday we'll have all of this stuff and things will be better, ain't going to help people going to the ER this weekend or next weekend or the one after. So what are your thoughts on that?
Yeah, and I think there are lots of suggestions for that, too. On another station, there was a woman from New Brunswick saying that they now, in many of their emergency rooms, actually have, clinical professionals in the waiting room in emergency, acknowledging that people are waiting longer than they ever have before, and so that you can actually track if someone's condition worsens significantly. Mm-hmm. Another thing we don't talk about enough is retention of existing healthcare workers. So we know that nurses and others are leaving the profession in droves, paramedics as well, because of burnout and because of the challenges of the job, and because, frankly, they don't get paid a competitive wage with their peers across the country. There's a lot more that the government could be doing right now to ensure that we retain the healthcare professionals we have, because that is absolutely crucial. And so, I think it's definitely not an overnight fix. Everyone recognizes that, but there are so many things that could be done now that would just help us stay the course and, again, make sure that people have faith in our medical system, which, quite frankly, they pay for, they expect, and they deserve.
All right, I saw this story on the CBC website, I do believe it is. Ontario Premier Doug Ford's government is preparing to significantly ramp up the number of surgeries done in privately run for-profit clinics. Ford and the health minister are planning to make the announcement next week on expanding the number and range of surgeries performed in independent health facilities outside of hospitals. What are your thoughts on this type of move?
Well, Tim Houston is doing this as well. So, we were at a committee not long before the holidays where they talked about their agreement with Scotia Surgery and, doing more surgeries there. I think that, what the government will say is you're just paying for it with your health card. It's not private medicine. But back to my previous point about healthcare retention, when a private healthcare clinic staffs up, they are taking healthcare professionals out of the public system. So every nurse that is hired at a private surgical clinic is taken out of our emergency room, is taken out of our orthopedics, is taken out of our hospitals that are so deeply stressed. And I think we have to pay very close attention to that. I think Nova Scotians want a publicly funded healthcare system. I think we need to make sure that people have access to the surgeries they need. We do have some agreements like that right now. But I think given the challenges in staffing in particular, we have to be extremely wary of expanding that private footprint, because I don't think it will actually, in the long run, make our healthcare system better. And in fact, while it might serve maybe some short-term issues, I think in the long term it will actually make things much worse. And so I think, we're seeing the same thing again in nursing with travel nurses. So nurses leaving their employment with the government, being employed by a private agency, and then being deployed again in the same hospital they were working in before and getting paid a bunch more money. That's not what we want. This is why the government needs to look at retention and needs to look at wages and needs to make sure that we have the staff that we need. And all of this conversation about privatization is actually going to make that worse, and it's going to make our public system worse, and it's going to make it more challenging.
But I guess what I would say, okay, so then let's look at the public system that we do have, and when we look at the amount of funding that's going into healthcare, and some would say that we just cannot continue to spiral out of control when it comes to healthcare spending. It can't become 75, 80, whatever percent of our budget. We have to have some type of restraint. So potentially, might we look at, and I don't know if efficiencies is the right term, but in getting more of that money into frontline services and less of it potentially out of administration and bureaucracy. Is that something we could look at?
I'm sure it is. I mean, this is part of the reason why we want a public conversation about this, because like most people in Nova Scotia, I don't actually have a window into what that system looks like. It's kind of held under lock and key, so to speak. So, I think absolutely we need to make sure that our system is efficient and that it's working well and that we're kind of not top heavy from a bureaucratic end. But again, I think that we're fooling ourselves a little bit if we think we're going to save any money by increasing privatization. Because if you look at, we'll have a budget soon, and if you look at the money right now that's being paid by our government to private agencies to staff our hospitals with nurses at, a much greater expense than we actually pay them in salary, you'll see that, it's foolish. It doesn't save us money. So yes, I think there's a conversation, I'm sure, about efficiencies and about, if there's a perceived bureaucratic bloat. I don't know. But this is why we want to have a public conversation about it. Where is the money going? How are we spending it? Mm-hmm. And how do we improve the patient interaction with our healthcare system from, very simple things like community health and just remaining healthy and not having to go to the doctor and not having to go to the emergency room, to having primary care when you need it, to having long-term care when you need that, and to having the systems that we pay for available to us when we need them.
Okay, Claudia, I appreciate your time. Thank you so very much.
Thank you.
All right, take care. Claudia Chender, leader of the NDP. We'll take a break.